Sleep apnea is a condition where patients' airway collapses while they're asleep.
So they have what we term a micro-arousal. So the patient awakens slightly in order to gasp and take a deep breath.
Many people witness that and are familiar with that and think it's just a normal part of life. And really, we need to get the message out better that no, that is a serious medical condition.
Medical risks increased with sleep apnea include hypertension, arrhythmias or funny beats in the heart. There's an increased risk for heart failure, atrial fibrillation, a thing called pulmonary hypertension, and it increases cerebrovascular risk or stroke risk.
A prosthodontist is a specialized dentist with advanced training in oral health issues.
We specialize in the top part of the pharynx or the oral pharynx, the tongue, the tonsils, the soft palate, the arrangement of the upper and lower jaw.
And squeeze tight. It's been shown that patients see their prosthodontist more frequently than they see any other medical professional. That puts us in an important position to screen our patients.
In my practice, every patient that comes in, whether it's for replacement of a tooth or aesthetic change, they come in and they fill out questionnaires for sleep disruption.
Questions such as, do you or a family member snore? Do you or a family member choke or gasp for air when you're asleep?
Patients who have a lot of weight gain, hypertension, that's a red flag.
As many times happens in my office, the patient's bed partner presents them for treatment because of snoring.
I was having issues with snoring and keeping my partner awake.
Kept her awake at night. Kept me awake at night too.
Sleep apnea is diagnosed by a sleep study being performed and then that sleep study being read by a sleep physician.
I think the best sleep medicine is provided through a multidisciplinary team.
So, open for me.
Prosthodontists have a unique position in the treatment of sleep apnea.
I'm looking at the tongue size and volume because really the tongue collapsing backwards when they sleep and the soft palate, the drape of the soft palate and the narrowing in that throat is really the issue at hand.
Our physician colleagues can treat sleep apnea with CPAP, which is a continuous positive air pressure machine.
This is a CPAP machine. It takes room air, draws it in through the back here, filters and cleans it, pressurizes it. This is called a nasal pillow mask. It's small, sets up underneath the nostrils and it allows the air pressure to come in through the nose.
CPAP has been shown to be a very successful treatment if a patient can tolerate it.
The pressure of the air going in and out was very difficult to have, to be able to sleep with it.
Frankly, the mask was a little claustrophobic.
Patients whose sleep studies show that they have stopped breathing 30 times or less per hour, those are a patient who a mandibular repositioning device can be a first-line therapy.
This appliance here is an appliance where you can see on the lower appliance there is a wing. And so that wing is pushed forward.
Pulling the lower jaw forward applies tension to the tongue and makes the tongue more stable, which is important in sleep apnea because oftentimes collapse at the base of the tongue is one of the significant factors.
So a lot of patients will go on TV and they'll see oral appliances that you can get at the local drugstore.
They can cause joint issues for the patient. They can cause tooth movement in the patient. It's so important that a patient has mandibular repositioning device fabricated by the prosthodontist. I'm going to let you pop the appliance in place, because the device must be custom made for the patient. It must take into account the patient's anatomy.
Then they show you how to advance it and then they give you recommendations on how much to go each day.
I'm so used to it, I love it. It's been a huge help.
Is CPAP or an oral appliance better depends on the patient. It's what's best for the patient.
In prosthodontics, oftentimes patients come to us because it's complex. And when we look at sleep apnea, it's a complex problem.
I mean, this is the first, really, in 10 years that we've gotten any decent sleep.